Welcome back to Living 808. Today we are getting some insight on caregiving for elderly parents, and we wanted some information and resources for our viewers, so we've invited Dr. Poki'i Balaz on the show. Thank you so much for being here. We really appreciate it.
No, thank you for having me.
Now, I want to tell everybody, I've written it down. I've got it typed up. You're the doctor of nursing practice for the Memory Clinic at Kokua Kalihi Valley and Director of Strategic Initiatives at the Center for Innovation. She's also the policy advisor on the board for the State of Hawaii's Executive Office on Aging. You sure do have a lot of stuff going on. It sounds like a lot.
Yes, it is, but it's all wonderful.
I'm sure it is. And you have some firsthand experience that you'd like to share with us today on elderly parents on that topic.
Yes.
Give us your experience.
Sure, I'll start off with how I guess I got into caregiving. So my journey really started about 18 years ago. My mother started to notice that Dad just wasn't the same. And then I began to notice. And so from there, I was completing my bachelor's, and then I had moved to the States to begin working. And I really didn't want to leave, but I needed to go. So caregiving really began for me then, and then started as caregiving away, talking with my mom, hearing what the providers are saying. By 2012, my mother had called and asked me to come home. The challenges of caregiving were a lot. There wasn't a spotlight on Alzheimer's and dementia like there is now. There wasn't that many resources. And so Mom asked me if I could come home. And I did. I came home willingly. It's an honor and privilege to care for Dad. I would do it again, even all of the challenges. So I came home in 2012, and that really is when my journey immersed me into caregiving, which my medical background didn't prepare me so well for the caregiving aspect.
Yeah.
And that's when I really got to understand what are the challenges, where are the resources, how it hits you emotionally, and then as the disease progresses physically, and then the financial challenges that come.
Right. There's a lot to think about.
Yes.
And there's also probably a certain level of burnout for caregivers. Could you maybe give us some warning signs of folks that may be feeling stressed or that burnout?
Oh, definitely. So a lot of times when we're talking about caregiver stress and burnout, and I'll be honest, I have had stress, I've had the burnout.
Yep.
I think I've even made it to the compassion fatigue. So we talk about it a lot in caregiver stress, then there's caregiver burnout, and then the compassion fatigue. And some really, I guess, they're not always obvious. Caregivers, and I will have to say it many times, don't always align with the word caregiving because it's what your family taught you to do or your culture. So I didn't see myself as a caregiver until I reached out to the Alzheimer's Association and realized, oh my gosh, I am a caregiver.
Yeah.
And so when we're talking about stress, whether you're a professional or living at home, is things like when you just start to know that something's not right, it can be simple things like lack of sleep, lack of energy, loss of appetite, maybe increased appetite, losing weight, gaining weight. But then there are some things that are not always representative or people are not, I wouldn't say aware of, but things such as not being able to care for your own needs as a caregiver, like really not being able to take care of yourself physically, emotionally, mentally, getting sick all the time. Many caregivers, because our life revolves around the person we're taking care of, we put ourselves second. So we're getting sick, we're going to the doctors. Not having any energy, no matter how much sleep that you get. It's just this really lack of energy, this motivation, and sometimes it will manifest into physical problems such as chronic headaches, stomach issues, which is more along the line of compassion fatigue. And the stage before that, such as caregiver burnout, we're looking at things like procrastination, we're showing up to work late, sometimes we're not meeting our deadlines. And so there's a lot of difference, and I think for every caregiver, it may be different and manifest in different ways.
All that stress, it can lead to elderly abuse from the caregivers. Maybe you could tell us how to prevent that?
Sure. So we're talking about elderly abuse, and that's a great question, and thank you for that. There's physical, there's emotional, or there's financial abuse, there's neglect, and sometimes, especially around neglect, it can be unintended. Caregivers are facing so much challenges, but I also want to pause and say that while we're going to focus on that it is not only the challenges and the unending grief that comes, that there are good moments. There is life still left in Alzheimer's, and there are good moments in caregiving. But due to the challenges that can happen, sometimes there are different types of neglect or abuse that show up. Sometimes it's intended and sometimes it's unintended. And for those that are facing those situations, we can do things like regular checkups, having support, communication, checking your loved ones or your friend, because it's not always family caring for someone, their bank account, or just being aware, are their clothes getting washed? Are there any sores on the bed, sores or cuts or bruises that aren't being attended to? Does it look like things are being cared for, whether they're in a facility or at home?
And we're going to have some tips on our website for caregivers. You can join us there at KHON2.com. But for those that want a little bit more information, maybe some resources, can you give us a place to go look for that?
Definitely. There's so many places in Hawaii. So you can start with places like the Executive Office on Aging, Elderly Affairs Division, the Caregiver Foundation, the Alzheimer's Association. Many of them can point you in the right direction, or even APS. You can call Adult Protective Services also.
Anything else that you might want to add?
Yes, just wanted to let caregivers know that one of the main things to do is to implement self-care, to take care of yourself. It is so true that you have to take care of yourself to take care of someone else. And to please reach out to the Alzheimer's Association or many organizations, or you can even reach out to me to learn about how you can implement a self-care for yourself.
Well, I know that you're really busy, so thank you for stopping by. This is such a huge topic, and I know that it affects a lot of people, especially here in Hawaii. So thank you for taking the time out. We really appreciate you being here.
Thank you.